Welcome back. Thanks for staying with us. Three major hospitals in the Western Cape are likely going to run out of funds by the 15th of January. According to CEOs at Groote Hospital, Tygerberg Hospital and the Red Cross War Memorial Children's Hospital, this is all as a result of budget cuts in the province. Now, the hospitals have now decided to downscale the services as measures to avoid running out of funds. Professor Alex van den Heever from the Wits School of Governance, as well as Dr. Mvuyisi Mzukwa from the SA Medical Association, the chairperson, joining us now for this discussion. A very good afternoon to you both, gentlemen. The CEOs of the Western Cape's three academic hospitals have warned that because of this severe funding cut, they could run out of money. A very frightening revelation. Dr. Mzukwa, perhaps let me start with you. It's a disaster waiting to happen.
Good afternoon to you, and good afternoon to you, Alex, and your viewers. This is a very worrying trend that we are going to see not only in the Western Cape, but we are going to see in other provinces as well. Because if you listen to the speech of the Minister of Finance during the midterm budget policy statement, it really is something that we captured there that worried us, keeps us very anxious as the South African Medical Association. When it says that to minimize negative effects, the health sector will need to improve efficiency in areas such as overtime payments, medical supplies, security services, and the delay to delay the infrastructure projects. And, we're not surprised then that at that point we realize that we are in for a big trouble. Because if you have hospitals like those who are running services, who are contemplating on cutting down, because of these shortages in the budget, it's really starting to impact us negatively. And there are consequences like litigations that are going to come out from that.
Yeah. Professor van den Heever, departments in the academic hospitals have been asked to reduce consumables by 50%, which is pressure on an already struggling public health sector. Is it reasonable for Treasury to expect cost cuts in that department?
The question, those particular three hospitals are a surprise to me that they would be in such financial difficulties, because the Western Cape is traditionally the best managed province and the finances in the health sector are the best in the country. And what this is really a consequence of is an in-year reduction in fiscal space for the province, largely resulting from decisions made by national government, and two of which are the bargaining chamber, the wage and salary increases, and the decision not to properly fund them. And there's a further issue that probably impacts on the Western Cape, and that is that the adjustments to the provincial equitable share may not be entirely fair. So this does have to be carefully analyzed, because the Western Cape's population is rising, and I note in the allocations that the Eastern Cape's population is in decline, but its budget is substantially being increased in terms of the provincial equitable share. I'm not sure how whether these allocations are being done correctly. And there is a concern I would have that going into an election period that the Western Cape is being targeted. I think that this does need to be fully investigated, because if this is truly the case, then there are serious consequences for National Treasury's allocation of funds. This cannot be how you allocate funds. But on the issue of all the other provinces, many of them are extremely poorly managed from a financial perspective. And they are much less capable than the Western Cape in being able to handle fiscal shocks, which come through salary and wage increases. So big in-year adjustments are almost impossible to manage and will have consequences. And I think that I'm really concerned that there is an arbitrariness to the allocation process. This part appropriation process impacts negatively on the financial management of the government as a whole. And it doesn't look as though they have properly protected frontline services and healthcare services from decisions made by national government. And that, I think, is just improper.
Dr. Mzukwa, what would you imagine to be some of the knock-on effects to these decisions? Surely the hospitals now will start to lose specialists or perhaps fail to train doctors who won't be able to do training.
Well, we all know, as it was said by the Minister in Parliament, that there's a dire shortage of healthcare workers. And already they are doing overtime, but also they are having problems like mental illnesses like burnout and depression and stuff like that. So if you continue, to avoid hiring, healthcare workers, obviously that is going to have dire effects on their well-being as workers. But also, if you look, for example, the issues that have been identified, like your security measures in the workplace and also infrastructure, it remains a concern for us because we know that we are dilapidating hospitals, as it has been pointed out by the health ombuds and everyone who's been in that space. So it really, to us, a major concern, that we find ourselves having to do this. But if you are talking about rolling out NHI, for example, how do you not hire more healthcare workers if you are going to be rolling out NHI? How are you not, for example, building hospitals? What sort of quality access are you talking about if you are taking down the number of institutions or even not maintaining the ones that we have now? What sort of NHI are you talking about? Are we being played here, or are we being told the truth by government?
Professor, what would you imagine to be some of the urgent discussions that now need to take place around this, because it's not going to get any better?
No, what we are seeing is unfunded mandates transferred to the provinces. They're placed in impossible positions to make adjustments. Some of these provinces have really low capability organizations. They're very weak administrations. They can't cope with big shocks. And there is massive corruption that occurs in most of these provinces. And all of those drain away the funds. There's also, in many cases, bloated administrations. This isn't doctors and nurses necessarily, but administrations, people that shouldn't be there, and very, very poor organizational design. So those are all there, but the problem is that the overall crude nature of the budget process as administered to date is seriously harming our delivery of services. These are actually quite sophisticated services at the end of the day, and they're treated rather brutally. They're treated brutally both in terms of the leadership that is placed in charge of them, which makes them very weak at responding to shocks. But they're also treated very crudely in terms of the financial allocations. It's very arbitrary in many senses. I could go into detail, the whole conditional grant framework, the way in which the provincial equitable share allocations are designed. Many of these issues have been discussed for a number of years. The lack of sophistication in our budget process due to the lack of evolution and depth in National Treasury and in key departments like the Department of Health have really resulted in weaknesses building up over time. And one of the big consequences in the provincial delivery is that whenever these financial shocks come through, the maintenance and facilities management tends to be cut drastically. So we don't end up maintaining facilities for long periods of time. We can't repair equipment. We can't do anything to even to tread water. Go backwards as a consequence. And we also have in terms of the issues also mentioned earlier, there is no apparent forward planning in relation to any of these issues. They're just a 12-month planning trajectory in which relatively arbitrary decisions are made when people overshoot. So we really do need an improvement in the sophistication of the health system, and it's not going to come from national health insurance. It's going to come from a change in focus and visioning at the national level. And unfortunately, I would say it's not there at the moment, and it's really harmful to people.
Yeah, because they're saying that no funding proposals were even identified within this process.
No, so so National Health Insurance doesn't have a financial plan, but it also doesn't have a way of addressing many of the sophisticated problems that we face. So we're really sitting with what appears to be a policy framework and set of policy processes at national level that appear to have their eyes and their gaze focused elsewhere and not on our health system. And this is what has to change. We really need something to change, but I'm really concerned about what will happen in the current financial year to our health services. I think that this wasn't warranted, and government should not have approved wage agreements that it could not afford. That can't be done and then imposed on our health system and then on our patients. That's a problem in government and how it operates. The one hand doesn't appear to know what the other hand is doing.
And Dr. Mzukwa, just closing the discussion with you, what would you say would be, some of the big concerns? Because according to the head of one of the departments at one of the 3 hospitals, they spoke about how they're going to be heavily impacted by the freezing of posts. Because, it begs the question, what will happen if a surgeon, for instance, would have to resign? Does it mean that the surgeon won't be replaced?
It's going to have dire consequences, because you recall that we still are suffering from the impact of load shedding on healthcare and the backlog that it created. On top of that, there was COVID-19. So there are so many of these things that are going to impact us negatively. It means that there is not going to be any replacement or repair of the equipment in the hospitals. If you have got a broken X-ray or broken CT scan, it's not going to be replaced. And that has got serious implications on the delivery of services in the hospitals. But on top of that, if you are saying you are not going to hire more healthcare workers, then it means you want to enslave the current healthcare workers. Doctors and nurses and the porters, everyone in the institutions, because they need to work 5 times what they are supposed to do, because they are covering other people's jobs. But on top of that, you will understand that it will lead to more litigation, because if you've got 1,000 patients and you've got 3 doctors, it's going to be a disaster. So I think we are really facing a very tough time, but government is going to put us in all this a problem that we are facing now.
Perhaps very quickly, Professor van den Heever, you mentioned something quite significant as we were trying to make sense of how this could have happened, this big pinch on the budget, saying that perhaps if it is the case that the Western Cape is being targeted ahead of elections, what sort of scenario then does that, what sort of narrative does it build ahead of elections in the Western Cape?
Well, our entire constitutional framework is based on the fact that there will be equitable allocations between the provinces. In other words, that government will not at the national level, will not prioritize provinces based on which political party is in power. But right now, when Groote Hospital, when those hospitals say they're facing financial constraints, when I know the quality of forward planning for financial management in that province way outstrips what's happening in the other provinces. When they say they're going to run out of money in January, that implies that there has been a drastic reduction in allocation to the Western Cape. And I think that one would have to look very carefully at what's going on, because it doesn't appear to make sense given the population size of the Western Cape and even its socioeconomic breakdown. It appears as though people are nudging the criteria in order to prefer other provinces and also potentially to make the Western Cape look bad. If that is the case, there are serious implications, and this has to be looked at in detail. And I think that National Treasury has to answer that question, show exactly what you're doing, and that this criteria, and demonstrate that your criteria has not actually been applied in a biased manner.
Yeah, very well. Thank you so much, gentlemen. Thanks for weighing in on this discussion. Professor Alex van den Heever from the Wits School of Governance, as well as Dr. Mvuyisi Mzukwa from the SA Medical Association, the chairperson there, of course, giving us their insight on the budget cuts in the Western Cape.